Pnawn da. Eluned Morgan dwi, Gweinidog Iechyd a Gwasanaethau Cymdeithasol yn Llywodraeth Cymru. A heddiw gyda fi mae Dr Gill Richardson, Dirprwy, Brif Swyddog Meddygol yn rhaglen Brechlyn Covid-19. Diolch I chi am ymuno gyda ni unwaith eto. Thanks very much for joining us again. Last week, we updated you about the emergence of the new Omicron variant and the actions we've immediately put in place to respond to it. Now, this is a worrying new development in the pandemic. Yesterday, Public Health Wales confirmed 3 more cases in Wales, bringing the total to 4. But we have to prepare for cases to rise quickly and sharply. There's a lot we still don't know about Omicron, but all the evidence we do have so far suggests that this is a fast-moving form of virus which will quickly overtake Delta as the dominant form. We need to do everything we can to protect ourselves, and that includes increasing vaccination. We've accepted the JCVI's recommendation to expand the COVID-19 booster programme to all eligible adults and to offer 12 to 15-year-olds a second dose of the vaccine. Heddi, I ni am egluro sut byddwn ni'n cynnig brechiad atgyfnerthu I bob oedolyn sy'n gymwys erbyn diwedd mis Ionawr. Bydd hon yn ymdrech enfawr arall ar gyfer ein rhaglen frechu a'n gwasanaeth iechyd sydd wedi gwneud cymaint yn barod I ddiogelu pobl ym mhob cwr o Gymru. Today, we'll explain how we'll offer all eligible adults a booster by the end of January. This will be another huge effort for our vaccination programme and for our NHS, which has already done so much to protect the people of Wales. It's just over a year since the first COVID-19 vaccine and the Pfizer-BioNTech vaccine was approved for use in the United Kingdom and the first doses were given in Wales. The development of the rollout of these vaccines has been remarkable. Now, before I hand over to Gill, who will explain more about our plans, I want to show you this slide. It shows the incredibly high take-up of the vaccine across all the priority and age groups for the first and second doses, and that is the dark blue line. The yellow line shows the progress so far of the booster programme. More than 80% of people aged 65 and older have had a booster vaccine. Over the last 18 months, our amazing 12 months, our amazing vaccination teams have delivered more than 5.5 million vaccines to the people in Wales through a new service which was set up from scratch. That's the equivalent of 15,500 vaccines a day, every day, for the last year. Mae'r hyn sydd wedi cael ei cyflawni wir yn anhygol. Dwi am nodi'n swyddogol pa mor ddiolchgar ydw I am gyfraniad pawb sy'n cymryd rhan yn y rhaglen frechu. Diolch am ei gwaith caled dros y flwyddyn diwethaf a diolch hefyd iddyn nhw am ei help dros yr wythnosau sydd I ddod. This is truly an incredible achievement and I want to place on record my thanks to everyone involved in the vaccination programme for their hard work over the last year and for their help in the coming weeks. Gill, I'll hand over to you now.
Diolch yn fawr, Minister. Last week, the Joint Committee on Vaccination and Immunisation recommended a large expansion of the vaccination programme to increase our protection against the new Omicron variant. This really is a huge task, but we are confident that by the end of January, we will have offered all eligible adults their booster. The more boosters and vaccines we can give to people over the next couple of months, the best chance we have of preventing harm as cases of the new variant rise. We have sufficient supply of the Pfizer and Moderna vaccines to do this. We have already started ramping up the booster programme, but to ensure that we can maximise protection for everyone, we expect to be offering more than 200,000 appointments every week. After we have received the JCVI advice, we've been working very closely with the NHS to put plans in place. Health boards will be providing more vaccination centres in easy-to-access locations, including walk-ins and drive-thrus, where possible, super sites. We will also have longer opening hours into evenings and weekends and extra lanes at the mass vaccination centres. We'll be working with GPs and community pharmacies to deliver the vaccine and with local government, fire services and students to provide other support to clinics. If you can help the vaccination programme and want to volunteer, please get in touch. There will be details on the Welsh Government website and on Health Education and Improvement Wales for professionals. We are also going to be requesting support from our colleagues in the armed forces once again. We will be inviting people to come for their vaccination in order of priority. We will follow the JCVI advice and work through the age groups and those most at risk. So please wait to be invited for your booster. However, if you are over 65 and have not yet had a letter about your booster, please do get in touch with the Health Board. Details will be on the websites. And there will be contact information on the Welsh Government website also. I would urge everyone to do everything that they can to keep their appointment. If you are an employer, please give your staff time off to get vaccinated. For many people working in the vaccination centres, their annual leave has been cancelled and their Christmas plans changed or disrupted, as we do everything we can to vaccinate as many people as possible. And of course, for many, this is their second Christmas that they have spent vaccinating people. Please support them by prioritising and turning up for your appointment. And if you really cannot make it or have been ill, please rearrange the appointment. We are introducing a new text system which is going to make it easier for people to reschedule. And lastly, I want to add my personal thanks and that of our central team and our chief medical, nursing and pharmaceutical officers to everyone taking part in this huge national effort over the next couple of months. Your service is truly remarkable and we thank you. Minister.
Diolch yn fawr, Gill. Sdim gwahaniaeth os taw hwn fydd eich brechiad cyntaf neu eich brechiad atgyfnerthu. Please, ewch I gael eich brechu. A pheidiwch ag anghofio, os nad ydych chi wedi bod am apwyntiad yn gynharach yn y flwyddyn, dwi byth yn rhy hwyr I gael eich brechu. Doesn't matter if this is your first vaccine or your booster, please just say yes to the vaccine. And don't forget, it's never too late to be vaccinated if you missed your appointment earlier in the year. For the last 12 months, vaccines have been our best defence against the virus. They've saved lives and have weakened the link between infections and serious illness, preventing thousands of people from needing hospital treatment. Dros yr wythnosau nesaf, felly rhowch flaenoriaeth I gael eich brechiad neu'ch brechiad atgyfnerthu. So please make getting your vaccine or booster a priority over the next few weeks. It's one of the best ways we can disrupt the transmission of the virus this winter, especially as we face the new uncertainty of the Omicron variant. A vaccine will be the best Christmas present you can give yourself and your family this year. Diolch yn fawr. Gill and I will now take questions from journalists, and as usual, all the answers will be broadcast live on our social media stream. So, Owain Clark, BBC Wales, I ddechrau.
Diolch yn fawr, thank you both as always, and this is a question to both of you. Nobody, I don't think, underestimates the scale of the challenge here. This is going to be a huge effort. You're asking for volunteers, you're also will be asking for military support, but you also talk about staff having to cancel Christmas leave and disrupt their own Christmas plans. So to what extent will you have to move NHS staff from other areas to achieve this, and what assessment have you made of the impact that might have during this most difficult winter?
So our NHS staff are doing an amazing job, accompanied also by our social care staff and those in local authorities, third sector and partners. We have every knowledge of how much we are demanding from them. We know also that they are in need also of rest breaks with their families, and so health boards will be planning very carefully to make sure that nobody is going to miss out on time with their family. There will be time for everybody to have a break over that period, but it will not be as long perhaps as they would have liked. And we are very cognizant also of the fact that the system is extremely stretched. And so we are asking for additional help, and we, as I said, will be having a facility for retired health professionals to rejoin us, as they did last time, and many others, such as St John Ambulance, etc.
Thanks very much. So many people have already stepped up. We have a volunteer army who have been wonderful. Clearly the NHS will be prioritising this. That has been an instruction to them. What we're looking at is a short, sharp burst of activity. Clearly that may mean reprioritising, and there is flexibility within the system to be able to respond according to the capacity that's available. So there may be a need to reduce some planned care, but we're obviously hoping that we can keep our GP surgeries going as usual. Some have stepped up and have offered support, but we're not expecting that provision within our community to be reduced at this time.
Gai gofyn fawr Gweinidog ar yr ateb yna, gai ateb Cymraeg ar hwnna, os gwelwch yna hefyd, please, ar y cwestiwn gyntaf.
Yn amlwg mae staff yr NHS eisoes wedi bod yn ddiwyd yn ailgynllunio y ffordd maen nhw'n mynd i weithredu dros yr wythnosau nesaf. Beth ni'n edrych ar fan hyn yw burst bach sydyn fel ein bod ni yn gallu gwneud y gorau cyn bod unrhyw don yn cyrraedd ni. Ac felly yn amlwg fe fydd angen i gweld flexibility tu fewn i'n system ni. O ran GPs er enghraifft, ni'n gobeithio mi fyddan nhw yn parhau i roi'r gwasanaeth yn y gymuned.
Thank you very much indeed. Second question, for whoever wants to answer really, and in both languages if possible. What have you learnt about the characteristics of Omicron since you last spoke to us last week that convinces you that ramping up the booster campaign does indeed offer the best protection, especially relative to introducing any further restrictions, because we know you and the Cabinet are discussing the latest 3-week review this week?
Shall I start? Thank you. We have learnt more about this variant over the last week. We know that it is the most diversified variant so far of COVID. We know there are 32 new changes to the spike protein. We know that there are 10 changes to the receptor binding domain. So these mutations actually mean that this variant may sidestep natural immunity that has been achieved through infection, and we are concerned that it may have properties which might sidestep immunity from vaccines, although at the moment we do not have any evidence to support that. We do know that the Delta variant, when it started, was far better, curbed by 2 doses than 1, and 3 doses are better. So if people have not had any vaccine so far, they really are the most at risk. And if they have had some vaccines, that's fantastic. But if they can get to a stage of being fully immunised and then having their booster, they will have the best protection. So we know that in South Africa, cases are rising quickly, that the doubling time, so the number of cases, it's 5 days, basically, to have a doubling of cases, which is extremely rapid, and so that is concerning. And we have seen that there have been a rise in hospital admissions in South Africa. So it's enough that we need to be cautious while we're finding out more about this variant.
What we do know is it spreads very rapidly. That is clearly cause for concern, as Gill has stated. I think what's just as important is to underline what we still don't know. We don't know how sick this variant makes you. We have been monitoring the situation, for example, in South Africa, where we've seen hospital admissions go up from about 143 to 788 in 2 weeks. So that clearly gives us cause for concern, but we don't know if that's a pattern that we would see reflected in our population. As Gill has mentioned, we don't know the extent to which our vaccines will give us protection, but we do think that they will give us a lot more than having no vaccine at all. So that's why our plea today is, please help us in this situation. We have an army ready to roll out this vaccination programme, but we need the public to come with us. We need you to step up and to step forward when you're called. All of those people over 65 should have been invited for a vaccination already. But please, if you're under 65 at this point and you haven't been invited for a vaccination, even if it's been 6 months since your second jab, please don't contact the health services. They are genuinely under huge pressure at the moment, and we need to get this done as quickly as possible. When you're called, though, please answer that call. Fi ateb hwnna yn Gymraeg hefyd, Owain.
Very please.
Beth i ni yn gwybod yw bod yr ymlediad o ran Omicron yn gyflym dros ben, ac ni yn disgwyl gweld ton mawr yn cyrraedd ni. Beth dyn ni ddim yn gwybod yw'r raddau mae Omicron yn gwneud chi'n sal. I ni wedi bod yn edrych ar canlyniadau hyd yn hyn o dde Affrica. 143 o bobl wedi mynd i'r ysbyty, ac pethefnos yn ddiweddarach 788 wedi mynd i'r ysbyty. Mae hwnna'n amlwg yn creu problem, ac mi fyddwn ni'n cadw llygad ar y sefyllfa, achos yn amlwg falle ein bod ni mewn cyfleusterau gwahanol yma yng Nghymru. Mae'n bwysig bod pobl yn cymryd y cyfle i gael y frechlyn os a pryd maen nhw'n cael eu gwahodd i gymryd y cyfle yna. Bronwen Weatherby.
Good afternoon. You say you expect a sharp rise in Omicron cases, but if hospitalizations and deaths don't increase as significantly, do you think the Welsh Government will refrain from introducing further restrictions over the festive period?
Would you like to go first
Yes.
again, Jill?
Yeah. I think obviously we would like to impose the minimum restrictions possible whilst maintaining a safe approach to COVID. And that includes this variant. At the moment, we have just 4 cases in Wales. 3 of those are associated with travel. So obviously travel restrictions are important, as are self-isolating if you have any symptoms that could be due to a respiratory virus, because at the moment we do not know what the symptom pattern will be with this particular variant, whether it will be different to others or not. So the advice really is to be sensible and be cautious. Make sure that you do not go outside if you're feeling unwell. Make sure that you get tested, and make sure that you use our test, trace and protect system. And then also just to make sure that you do not transmit it to anybody who's vulnerable. Please do take lateral flow tests before going visiting elderly relatives or anybody who's vulnerable. And if we all take the measures that we've been taking all the way along, ventilating our rooms well, wearing face coverings when we're in close contact with others, hand hygiene, and just general respiratory etiquette, then we should be able to keep each other safe for as long as possible.
Thanks very much. Just to add to that, I think it's probably worth noting that Delta is still alive and kicking in our communities. It's clearly not as prevalent as it was a few weeks ago, but we shouldn't ignore the fact that despite the fact we've got only 4 cases Omicron so far, that Delta is still a threat within our communities. I think we also need to make it clear that we are expecting a significant wave of Omicron to hit Wales. The modelling suggests that will reach its peak by around the end of January, which is why there is an urgency in terms of getting people's vaccinations and their boosters done as soon as possible. What we know is a small reduction in the effectiveness of the vaccine could have a significant impact on the NHS if we literally saw hundreds of thousands of people being affected by Omicron. So it's about the numbers of people who will be affected, and it only takes a small change in the effectiveness of the vaccine, which we still don't know, for it to have a significant impact on our NHS.
Thank you for that. And do you know how many vaccines in Wales have been destroyed so far? And how do you feel about the argument countries such as the UK should be helping roll out vaccines globally to prevent the spread of variants such as Omicron?
We've been really careful to try and not waste any vaccine at all. Obviously, sometimes there are circumstances that may happen, such as cold chain failures, that might influence that. And we do publish regularly our vaccine statistics and our vaccine usage and wastage. So far, that has been fairly low, but obviously as we expand the programme, as it becomes more complex, and as we reach more venues, there is a risk of higher wastage, and that is inherent with having a fast-paced, disseminated programme. But on a four-nation basis, we think that we're doing really well with our vaccine wastage. We are very, very much in keeping with your question of the opinion that the whole world needs to be vaccinated actually to protect us all. And so we have been working very closely with colleagues in across the four nations to look at what vaccine can actually be donated or diverted. And so we will continue to do that. And our ministers have been in close contact on that.
Thanks. My understanding is that COVAX has already committed to distributing 100 million doses, which I think is the second biggest contribution to the developing world. But I think it is worth underlining that we're not just all in this together in Wales, we're all in this together across the globe. And who knows where the next threat may come from. It is absolutely clear that we need to work together across our whole planet if we are going to defeat this very difficult time that we're living through. Adrian.
Thank you. Could you tell me how quickly the operation will be up and running? You said that the army is the army of volunteers and others is ready, but I assume it would take a couple of weeks. And weather like we're having today could put people off standing in a queue outside a vaccination centre. In other words, have you got a plan to try to make sure that the programme doesn't go backwards during this interim period?
Yes, I mean, you're absolutely right, Adrian, that our worst enemy is the weather. The snow definitely disrupted things last year. So we need to aim for a really high daily vaccination total that perhaps is even more than, what we need to do per day. So we are working very hard. We've been actually preparing right from the announcement. Efforts have been going on to double our intensity. More invitation letters have gone out. People have been absolutely incredible in volunteering for more shifts, and new members are on their way to assist. So we have already started, and it is a gradual incremental ramp up. And we just do appreciate how difficult it is sometimes for people when it's like this. You don't feel like going out, but please prioritise your appointment wherever you can. And the staff are waiting there for you, and they will have been there on a very long day, and will do everybody that's scheduled in. Thank you.
I think it probably is worth underlining the scale of what we're trying to roll out here. Over 200,000 vaccinations per week. That's, you think about the population of Swansea is about 246,000. So that's a lot of vaccines to be rolling out on a weekly basis. We're going to get to 1.3 million additional people over the next few weeks. It is a Herculean task that we are just about to undertake, and we know, because we've done it before, that we're able to do this, perhaps not in the kind of short time frame that we've envisaged this time, but that is why it is absolutely essential that people come forward when they're called. There is no time to waste with this one. We know that the Omicron wave is likely to hit us in very, very quickly. By the end of January, we would possibly have reached the peak, and therefore we do need to get these vaccinations into people's arms as soon as we possibly can. So please don't miss your appointment, because clearly it throws the system out, and it may be difficult then for us to. You will find another appointment, but it may take a bit more time. Time is not on our side on this one.
Thank you. Can I ask you both how the four-nation approach is going? Dr. Richardson at the medical and scientific official level, and Minister at the political level, please.
Yeah. So certainly at the official level, we have very regular meetings. We still have weekly meetings with our counterparts in Northern Ireland and Scotland and England. And in fact, every time the JCVI advise new guidance, we meet often over the weekends. We'll be working on plans together. It has to be very much dovetailed with our vaccine procurement. And so that's why it's essential that we continue to work at a four-nation level as well as at a Welsh level.
I think it's very useful for us to have a common approach, certainly in terms of messaging, making sure that the public are hearing the same messages, which is why we've all worked together to respond to the JCVI advice, in particular on vaccines, so that we have a common approach. We have weekly meetings, again, like Gill, sometimes those are called urgently on the weekends. So all hands are to the pump on this one. We are all in a situation where we are planning very carefully, very seriously for what could be coming our way. Ruth Mazalski.
Thank you both. Can we ask what your advice is to parents who are looking forward to Christmas, either in terms of going to visit people or going to see family, given that a school in Ceredigion today has closed due to cases in both staff and pupils?
Well, at the moment, clearly we'll be making some further considerations as the week goes along. On Friday, the First Minister will be making some announcements. I think in terms of the current situation, it is clear that people should act with caution. Christmas is a time when people do like to get together. We would recommend that if people are getting together, in particular with those who are frail or vulnerable, that they should be taking a lateral flow test. So flow before you go is our message in terms of mixing with other people. But certainly in terms of schools, the Education Minister is keeping a very close eye on the situation, and clearly circumstances will vary from area to area.
Thank you. And then there was a poll today that 62% of people want to see those who are unvaccinated being barred from public places like non-essential shops and events and similar. We know that's a measure that countries like Germany, Italy and Austria have already brought in. Is that something that Welsh Government is talking about and has considered?
It's not something that Welsh Government has considered. It is. We think that we've got very high vaccination rates within our communities, but it's absolutely, I think, in the interests of those people to understand that if they haven't been vaccinated, their chances of being hospitalised are massively increased if they contract the virus. So this is in their own self-interest. If they weren't sure about the data and the evidence before, there is plenty of evidence now to support the fact that if you are vaccinated, you are far, far less likely to be hospitalised. Dan Bevan.
Thank you, Minister. Good afternoon to you both. This is more of a question for yourself, Minister. You've said that early evidence shows that Omicron will become the dominant strain in Wales. But what is the early data telling you about the type of infections that we've already got here? Are the people who've been infected with Omicron seriously unwell? Are they in hospital, or have they got a mild illness?
Well, so far we've only got 4 cases in Wales. My understanding is that none of them are in hospital. So we clearly need to keep an eye on the situation as things develop across the world. A huge amount of investigative work is being undertaken at the moment to really test the extent to which our vaccines can protect people. And I think what's important is that whilst we are in a situation where we really don't know, that we err on the side of caution. And that's what our government is doing, is really preparing for the worst, but hoping for the best. We will put plans in place to protect the people of Wales, as we have done throughout this pandemic.
Thank you. And a question for the both of you. It's been reported that doctors in England have said that some ICUs are full of patients who are mostly unvaccinated. Now, that data isn't freely available in Wales. So do you know the numbers of people in Wales who are in ICUs who have had 2 jabs or who are unvaccinated?
We do regularly track the statistics on hospitalisation and vaccination status, and Public Health Wales do have some information on their dashboards on Tableau, which can be looked at. Obviously, as more and more of the population are immunised, actually it's hard to find those that haven't had any amongst those older groups who are more likely to be hospitalised. So what you have to do is you have to do a careful breakdown of the rate of hospitalisation amongst the unvaccinated compared to the rate of vaccination in those that are fully vaccinated. And being fully vaccinated, as the Minister said, is very protective, in fact, if you look at it on that basis. So one area, though, that we're always trying to promote more is the area of pregnant women, because we know that the ICU admissions for unvaccinated pregnant women are really much higher than they should be. And the ECMO treatment, which is the most intense form of intensive care, 1 in 6 of those patients at a recent audit were pregnant. And so we know that it is very difficult and that women are worried and concerned. But we would just ask them to talk to their midwives and to talk to their partners, because we have seen some real tragedies amongst pregnant ladies who have sadly left families behind and succumbed to the Delta variant. So we really want to get people immunised before the new Omicron variant comes, and we'd just reiterate that plea today.
Sorry, if I could just interject there. So you have that data with regards to the number of people who have who are in ICU but aren't double jabbed. So, but as I say, that information isn't available on the Public Health Wales website. So is that something that can be made available?
Public Health Wales are definitely collecting those statistics, yes, so can answer questions on that. Yeah.
Was there another question, Dan? Nope. Happy.
No.
Lovely. Harry Hansen.
Thank you, Minister. Good afternoon to you both. Of course, the announcement today that every adult will be offered a booster vaccine by the end of January is great news, and the take-up is already so strong. But of course, we don't really know how the Omicron variant reacts to the vaccine. So how can people be truly confident that further restrictions won't be needed in the new year?
Well, we can't give you any assurances on that, Harry, because we are still learning about the situation. We believe that the vaccines will give you far more protection, and the boosters will give you more protection than if you didn't have a vaccine. So we're working on that basis, but clearly we will be monitoring the situation. We will be responding in real time in relation to what is happening within our communities. We are expecting a significant increase in the number of people with the Omicron variant in Wales in the next few weeks. And clearly we will need to respond to the situation as and when we see that situation deteriorating. The extent to which we will need to intervene is clearly a matter that the Welsh Government is still considering.
Thank you. And building on that, I suppose, Previous studies have found that mixing vaccines could perhaps create a stronger immunity, and the UK's Deputy Chief Medical Officer, has said that it's something that may be considered for future booster rollouts. So now that we're here and we are implementing a booster rollout, is this something that the government will be considering?
Yes, Harry, that's very much part of the regular conversations that scientists are having across the 4 nations. And it's been fantastic to see the results of the COV Boost trial, which has shown that all of the vaccines used in the UK are actually very effective at giving a boost. But we know that the mRNA vaccines are particularly so. So in a sense, we are already mixing vaccines because those that have had AZ in the first campaign are now being offered routinely the Pfizer or Moderna vaccines. And those that have had Pfizer may be offered Moderna as their booster. And it's really great to see that all of these vaccines are very effective at protection and giving long-lasting immunity, which of course is different to if somebody has a natural infection. The immunity will not last as long, possibly only half as long as that induced by a vaccine.
Thanks. Tom Magna.
Good afternoon, Minister, and also to Dr. Richardson. My first question is about vaccination. Comes from our Carers World live audience. Can you give a clear statement of the priority for unpaid carers of all ages generally, including such aspects as whether or not the unpaid carer and the person they care for can be vaccinated in the same session? And also, include in your answer what advice you have for those who have immunosuppressed or immunocompromised conditions.
Yes, so if I take the first point, the last point first, is that okay, Tom? So those that have severe immunocompromise, as you know, were invited to have a 3rd dose of vaccine to make sure that their primary course had really given them that immune kick, and then they're now being invited also for a booster dose, and that's as long as it's been 3 months since their last dose of vaccine. So we anticipate that we will be able to get those individuals really well covered. And in fact, our latest figures are that 85% of the severely immunosuppressed have already come forward and had their boosters, which is really good. Unpaid carers are absolutely essential, and family carers. And this is very similar to the original rollout in terms of its priority, Tom. So a lot of the carers will fall within the group 6, and a lot of them will come with their loved ones and will be able to be jabbed at the same time. And we've asked for our health boards to be flexible, particularly because we know how difficult it is for people to make 2 journeys, or for a carer to make a journey without their loved one.
Thank you very much indeed for that helpful clarification. Can I take you to a different subject now, if I may, having the opportunity? I don't know whether, Minister, you saw the BBC Panorama programme last night about care homes and the effectively money pyramids behind the care homes, but poor levels achieved. And the examples were from England, but the principle possibly is the same. In Wales, what assurance can you give that the standard of personal care for a person and their friends and relatives in a residential care home, whether that's a local authority funded one or self-funded situation, make sure that it's not driven by money, but only the needs of the individual? Thank you.
Thanks very much, Tom. And I was very concerned to hear about the complex financial arrangements of some of those care homes. I'm pleased to say that we don't have many of those homes here in Wales. The majority are small and family-run enterprises, but we are absolutely determined to keep our focus on quality here in Wales, which is why, as you know, we've undertaken a very, very thorough framework. We want an all-Wales approach to this, and clearly we have a whole programme that we are keen to undertake during this Senedd term, which was very clearly set out in the Labour manifesto. Diolch yn fawr iawn i chi gyd.